Hi everyone. So today we have Dr. Pramod Chindar with us. Dr. Pramod is a director and head of the department orthopedic oncology at SCG. Welcome Dr. Pramod. So the first questions that comes to everyone's mind is that what is bone cancer and what are the causes, sir?
That's an important question, according to me. See, the bone cancer is essentially a neoplasm or any new growth, something which is dangerous, mainly in children. This occurs mainly in children. So, and essentially, these are all curable conditions if treated correctly. And these are mainly seen in children of the growing age. Why does it happen? There's most of the time we don't know why it happens. And in some small individuals, we have come to notice that in HCG also we have done a study and we have come to notice it is mainly it is the nutritional issue also maybe playing a role, which we will be publishing soon. Otherwise, most of the cases we don't know why exactly it happens. And some of the causes are the radiation induced osteosarcomas or something where there is a high chemical usage in the nature or in the ecosystem.
So doctor, who are the people that are mostly likely to get affected by bone cancer and what is the age they are getting affected?
Yeah. See, this mainly is seen in the younger age group. Say from I've seen my youngest patient, what I'm seeing is 6 months. 6 months to goes on up to 15, 20 years. It's the commonest age group, but it can be seen in adults. And most of the things, say, very important is in even in the working population, in the young adults, like say about when they start working, 20 to 30 years. There's one tumor of bone, which is very common called giant cell tumor. It's common in this age, which makes them very debilitating during the younger working years. So that is the age group mainly seen. And this is the age when the bone gets remodeled and the bone grows. So that is the most commonest age group and people. And male versus female, no, almost the same. Everybody gets the same. Yeah.
So what are the signs and symptoms of bone cancer?
Yeah. This is one thing which I want to drive with this video today is exactly what the question she asked. Symptoms. So I say an unusual night pain which disturbs the child from sleep. Okay, I'll repeat again. It's an unusual night pain which disturbs the child from sleep. That means the child will sleep and gets up in the middle of the night and it will not sleep again for few hours. So that kind of pain. And this pain is not relieved by the regular dose of analgesics. And you can see the history wise, they would have visited multiple doctors for the pain. And there will be no history of any physical trauma in these children. That means usually the neglect is, or he was playing a cycle, probably must have been hit, or in the bench must have hit, because most of the times it's around the knee joint. So when the knee joint is the most common, the bench hit injuries. I think we all know that we all get hit to the knee. So that's the most common correlation they do. So there will be no physical injuries, but the child will have pain. They get up at night. So it's very important for the young family or the mother, to pick them early. If you pick them early, it's essentially a curative case. That's very important. So identify early, pick them early. Doesn't mean that all the children will have this, but it's high index of suspicion in such an age. It's good.
So it's mainly the pain.
Pain, and then comes swelling. Swelling means first pain starts, then swelling starts, and some children will have fracture. So essentially, with present day is a good technology and advances in all the accessibility. In India, we are fortunate that we are having such good access to healthcare network. So hardly we see any fractured ones, but we see a very late presentations. But that's another thing which we need to penetrate, and we give awareness through such videos.
Doctor, what are the treatments available for bone cancer?
So the treatments are very important, and it has to be thoroughly investigated. First you have to do all the imaging, MRI and PET scan, biopsy, and then the treatment starts. In the treatment, mainly it is chemotherapy and surgery, along with a good amount of nutrition and rehabilitation, which is often neglected. So surgery is mainly limb salvage surgery. Limb salvage surgery means you remove the tumor. Earlier they were doing amputations. Now gone are those days. and we do limb salvage surgery which can sustain throughout their lives.
So what question patient should ask a doctor while consulting for a bone cancer?
Yeah. So important is, I would say, 3 questions. Number 1, whether the bone cancer is curable or not curable. Yes, if treated correctly, it's very much curable. Number 2, whether the limb or the leg, a hand, is it savable or an amputation? No. Now 90% of the limbs can be saved. The children can walk on their own limbs, use their own hands. Number 3, how long would the duration of the treatment would take? So generally it's about 6 to 8 months and depends on the severity of the treatment.
Thank you, sir, for explaining so much in detail, and this is definitely going to help our viewers. So if you have any further questions, please do write in the comment section below. Thank you.
Thank you.